A very warm welcome to all the viewers who have joined us today for this webinar. Earlier, our webinar got cancelled, which was going to occur on Thursday. It was rescheduled to this day on Saturday at 11 a.m. So I apologize from the team of Radaropus for cancelling the webinar on that day and rescheduling it again. So. Before getting into the topic, I would like to give a brief introduction about myself. I'm Dr. Neha from B Jain Group of Companies from Team Radaropus. I'm working with Radaropus and as well as I'm a private practitioner. I have MD in homeopathy and I have a master's in psychology as well. So our topic for today is managing mental ailments with the help of Radaropus. So Radaropus is a beautiful platform, and I'm really thankful to B Jain Group of Companies and Team Radaropus for giving me this opportunity that I'm here in front of you all, giving you my insights on mental ailments and how to manage them with the help of this software. So let's start with it. So mental ailments have always been a topic of fascination for me. So I was always interested in psychology and what is there in a person's mind, and that's why I opted for my master's in psychology as well after doing my MD. So this is a topic which is very crucial to me. So let's get onto the topic, and we'll discuss about what are the mental ailments, what are mental ailments in homeopathy, how to manage them. If you have a case of mental ailment, how to work that out in Radaropus. So let's get started. So, what are the mental ailments or mental disorders? So mental disorders or mental illnesses are the conditions that affect your thinking, feeling, mood, and behavior. They may be occasional or long lasting. They can affect your ability to relate to others and function each day. So, mental ailments definition or mental illnesses definition changes every few years. So, if you are aware of DSM, Diagnostic and Statistical Manual of Psychology, it is called. So, it is the most authenticated book on psychological disorders. So, every few years, a new version of DSM comes, and the classification of mental disorders, the definition of mental disorders every few years it changes. So I've tried to bring out what exactly mental diseases are. So anything in your mind which affect your way of thinking or your thinking, it makes your thinking slow, or it makes your thinking very hyperactive. It affects your feeling. If you're feeling low or you're feeling very exhilarated, it affects your mood. If it affects your behavior, all these things which causes all these different changes in your personality are mental disorder. So they can be limited to a short duration or a long lasting one. So they can be normal stress related like illnesses. You might have heard of post-traumatic stress disorder. So it might be short lasting, it might be lasting for very long years as well. So anything in the past of a patient which have created a trauma, the patient get flashbacks of that and he's not able to work out properly. It may last for a few days, maybe in months and years as well. Right? So few of the mental disorders are anxiety disorders. Right? Anxiety disorder. Then we have mood disorder. In mood disorders, we have disorders like unipolar disorders, bipolar disorders. Then we have various psychotic disorders. Psychotic disorders like schizoid like schizophrenias and disorders like that. Then we have eating disorders like binge eating disorder or bulimia nervosa, anorexia nervosa, impulse control or addiction disorders, quite self-explanatory it is. Personality disorders such as schizoid personality disorder, obsessive compulsive disorder. So these are the few major categories of different mental disorders. So moving on, what can a patient present you with when that you can suspect of any mental illness? So patient may come to you with with as simple as this thing that I'm feeling sad or I'm feeling low. So many times patient may come with we quickly take the rubric indifference or something like that, right? So you need to keep in mind, if the patient is presenting with the symptom, since how many days? If it is indifference, which has been recently developed, if it is in sorry, I was there was some interruption. So the indifference which have been recently developed, or it has been there since last few days, so there might be some trivial causes as well, like fight with the husband, or discord in the family, which may lead to indifference for a few days. Then it may be normal afterwards. So you need to make sure what do you want to take in the case, or what should not be taken into a case. Fine. So, one symptom was feeling sad or down, confused thinking, or reduced ability to concentrate. Fine. It happens in many cognitive disorders. Excessive fears or worries, or excessive feelings of guilt, even having a lot of guilt about small trivial things, is can be a symptom of mental illness. Extreme mood changes from highs to lows, so this can be a symptom of bipolar disorder. Withdrawal from family and activities can be a symptom of unipolar disorders, or what we generally called as depressions. Significant tiredness, low energy, or problem sleeping can be symptoms of many complaints. So many a times patient may come with just one symptom, that I feel sleepy all day, I don't feel like doing anything. So you need to dig up if it is if there is some cause behind it, how much time have occurred since patient is having this feeling, or if necessary you can send him, you can refer him to a clinical psychologist or a psychiatrist for diagnosis. Fine. So, significant tiredness, low energy, or problem sleeping, detachment from reality, delusion, paranoia, or hallucinations, inability to cope up with daily problem or stress. Very commonly, I am seeing this symptom in my practice. Very frequently, I'm getting the symptom. Like once a week, I get at least one or two patients who are presenting with the symptom of inability to cope up with daily problem or stress. So many females, they come usually of menopausal age, or in that time period when their children are getting settled down, or they are moving out of the families. They develop this symptom, like inability to cope up with daily problem or stress. So they say, they might present you with symptoms like, I feel like crying on very trivial things, I overthink a lot, and it creates me problems. So it is a very common symptom that you get these days. Then trouble understanding and relating to situations and to people, again a cognitive sphere of affection. Problem with alcohol or drug use, very quite self-explanatory. Major changing in eating habits. So physique conscious people may develop into eating disorders. So you might have heard of Princess Diana having uh, like bulimia nervosa, Karina Kapoor having anorexia nervosa. So, eating disorders are quite common. At current situation in these days, binge eating disorder is one of the major eating disorders. Then sex drive changes, excessive anger, hostility, or violence. Then we have suicidal thinking. So these are the few symptoms of mental disorders. Now coming on to diagnosis. Diagnosing a patient who is coming up with symptoms of affections in mental sphere is very important. You should know that what you are getting into. Just if a patient is coming with elevated mood and then depressive mood or change in state, change in mood, you cannot always prescribe pulsatilla or ignatia, drugs like this. You need to diagnose your case, like what exactly is going on with your patient. Is it is a true mental illness, or it is caused by some primary illness. So many a times, many primary illnesses such as hypothyroidism or androgen disorders may also cause mental disorders. So so diagnosis is a very important part. You should know what you are treating. So to determine a diagnosis and check for a related complication, following are important. Physical examination, a doctor should try to rule out physical problem that could cause your symptom. So physical examination, like you should check your patient thyroid gland, or if your patient is coming up with a specific problem, you are getting mental symptom, along with it you are getting some physical symptoms, or some part is affected, you should examine that part, and you should try to relate if there is any relation between that particular pathology and your patient mental complaints. Then coming on to investigation, in mental diseases, investigations are important. They may include thyroid function test, androgen levels, screening for alcohol or drugs, or brain imaging. So in many of the mental illnesses, psychotic illnesses, you get different changes in brain imaging. Like in cases of schizophrenia, there may be temporal lobe affections, may be there, you will get. So there is a thing known as white matter hyperintensities, that is commonly known as WHT. So white matter hyperintensity, so it get hyperintensified, white matter in your brain. So in unipolar or bipolar disorder, the frontal lobe hyperintensities are there, frontal lobe is affected. In case of schizophrenia, temporal lobe affections are there, because very commonly relatable, because in schizophrenia there are usually auditory hallucinations. So temporal lobe is related to auditory cortex. So that's why you can relate it over here. So brain imaging can be done in those cases. Always take a second opinion if you are going for things like brain imaging. Then a thorough psychological evaluation. A doctor or a mental health professional is a person who talks about the symptom, thoughts, feeling, behavior pattern. According to the case to case, there are different questionnaires that should be filled by the patient. So whenever a patient comes to me, and if I think of like that patient is having unipolar, bipolar disorder, I ask them to fill a questionnaire. One is a basic questionnaire that my every patient fills. Then one is the specific questionnaire for that specific mental ailment that helps me to psychologically assess my patient. So you can refer your patient to a proper psychologist for a psychological evaluation. So this was all about our modern medicine point of view. Now let's come to homeopathic point of view of mental ailments. So Dr. Henneman was one of the first physicians to see mentally ill patients as sick individuals. Earlier there was a notion that the part is affected, not a person is not affected, only that part is affected. And mental illnesses were not very well taken, they were taken as like that a person is delusional or a person is under influence of some supernatural power. Mental ailments was thought of with that thought process. So Dr. Henneman was one of the first physician who saw mentally ill patient as sick individual who require empathy and proper medical care. This have been stated by Dr. Hale. After that, according to Dr. Henneman, the mind and body are not two absolutely separate entities, but they form invisible whole, inseparable, in fact, distinguishable by mind for easy understanding. In natural diseases, the physical disturbances are often found associated with their mental counterparts. So nowadays, even modern medicine is acknowledging this, that if a person is having, in many diseases, the physical complaints have a precursor of mental ailments. So high level of stress, what we majorly call as lifestyle disorders, it includes many physical factors as well, but stress is one of the leading cause for many lifestyle disorders such as hypertension, PCOS. So nowadays even modern medicine is acknowledging that illness is a result of biological as well as of psychological events, right? So mental ailments, as they are stated in organon of medicine, in the organon of medicine, everyone might have gone through the section of mental diseases in organon of medicine. So Dr. Henneman have given detailed classification of 4 types of mental diseases. First is somatopsychic. Second is mental diseases due to an exciting cause. Third is mental diseases of doubtful origin. Fourth is psychosomatic type. So psychic type of mental disorders are those which begin as a corporal disease. First, the somatic complaints appear. In due course of time, bodily symptoms disappear and mental symptoms dominate. These are called as true one-sided illnesses. And now moving on to mental diseases due to an exciting cause. Sometimes insanity or mania comes from an acute onset syndrome, which may be caused by sudden fright, fixation, or drug abuse. So, exciting cause, if I give you an example, like sudden mania after death of loved ones, or hysterical reaction after death of their near or dear ones, is mental disease due to exciting cause. Then mental disease of doubtful origin, very easily understandable. Mental illness that are caused by fault of education, bad practice, corrupt morals, neglect, superstitiousness, and ignorance. Many a times patient may present to you with some symptoms, and when you go deeper into the case, then you might find that there are some superstition cause which is related to it, कि ऐसा करा तुमने तभी ऐसा होगा, you did this, that's why this have happened. So these are mental diseases of doubtful origin. Fourth is psychosomatic type, mental illness caused by continued anxiety, worry, vexation, frequent fear and fright may lead to some corporal disease. So just as stated, nowadays lifestyle disorders, many of the lifestyle disorders comes to psychosomatic type of mental disorders. Now, management of mental disorders. So if we go by homeopathic approach, mental diseases resulting from bodily disease and later transformed into one-sided disease. Treatment consists of judicial combination of antisoric treatment and psychotherapy, right? So, one thing in mental disorder cases or cases of mental illness is that you cannot only always rely on your medicines. Your medicine works very beautifully on your patient, but it should be psychotherapy should also be given to the patient, or whatever therapy is needed in that case. So I'll share you 2 of my cases. After that, I'll demonstrate you on Radaropus as well. So both of those cases were treated both by psychotherapy as well as homeopathy. So in mental diseases originating from psychogenic causes, if they are of recent origin, psychotherapy should be taken resource to. Third type of mental disease are to be treated exactly the same line that is followed in treatment of acute disease attacking individually, which are generally only a transient explosion of latent sora. So they should be treated by superficial acute remedies, not by antisoric deep acting remedies. So if something have been caused by some exciting cause, so an acute remedy should be given in that. Now coming on to general management of mental illness. So that was homeopathic management. Now coming on to general management. So general management of mental illness depends on type of mental illness one's have. So you cannot have same kind of auxiliary mode of treatment. You cannot have same type of general management in each case of mental illness. So it depends on severity and what works for best for the patient. In many cases, combination of different treatment works the best. if you have a mild mental illness with well-controlled symptom, treatment from primary care provider may be sufficient. However, often a team approach is appropriate to make sure all psychiatric, medical, and social needs of patients are met. This is especially important in severe mental illness such as schizophrenia. So, this point have two subpoints. One is if someone have mild mental illness, like if it is caused by some stressor or if it is very benign depression, it can be taken care of by primary care providers. So one should have a very calm, peaceful environment, and everyone should be encouraging towards the patient. And many times in severe mental illness, a team approach is useful. So it requires physicians approach, it requires caregivers approach, and even psychotherapists. It is a combination of all. Then we come to psychotherapy. Psychotherapy is also known as talk therapy, which involve talking about one condition and related issues with mental health professional. So in psychotherapy, if I talk very superficially, a patient talks about what are their condition, like what they are suffering from, not nosological terminology, like what are they feeling and what are the issues or problem that feeling or something is creating with a mental health professional. During psychotherapy, one learn about their condition and their mood, feeling, thoughts, and behavior. So in psychotherapy, one is made aware of their feelings and they're taught how to cope up with them. With the insights and knowledge you gain, you can learn about coping and stress management skill. Then, many a times brain stimulation treatments are required for depression and many health disorders. So, if the brain is not stimulated in the with the help of general management, then brain stimulation treatments may be required if medication and psychotherapy doesn't work. So, this include electroconvulsive therapy. So electrocution is done of patient, repetitive transcranial magnetic stimulation, deep brain stimulation, and vagus nerve stimulation. So before going into these treatment, one should be very well aware of their side effects. Now moving on. Now we'll talk about like two cases of mine. So first case is a bit recent case. So that case is a 1.5-year baby girl who presented with complaint of difficult dentition, constipation, very highly irritable, cross child, and there was inability to talk. That child was not able to talk, and loss of sleep. Very, very irritable and cross children. I haven't seen this much bad-tempered child ever in my life. So, moving on. When the patient, I'm just skipping all this part and I'm just telling you what, in my words, like what that patient was like. So the mother came to my OPD with her 1.5-year baby, and the moment she was all fine when the mother was carrying her, the moment she entered into my clinic with the baby, she started crying very badly, and she was hitting her mother, pulling her hair and all. So mother told that this is the normal behavior of a child. She gets irritated, gets violent, angry very easily. So when I inquired more about her, so what happened was both mother and father of the children are working, and they both were shifting, and they were not able to look after the baby as they were not living with their in-laws and all. So when they were shifting to a new home, they gave mobile phone to their daughter, and she used to see videos the whole day, like nursery rhymes the whole day. So she became so much addicted to that YouTube channel that even in night when she was asleep, she used to, blabber coco. Before that, her milestones were all right. She started to talk few words. She was blabbering. She started to talk. But even at that phase, when she was watching that YouTube channel, she used to talk a few words. After that, she like her intensity of watching that channel was very high. She used to watch that channel throughout the day. So there is history of YouTube addiction, neglect by parents and family quarrel. Child had normal milestone and started to blabber few words by the time she was 1 year old. Both the parents were working and they shifted their house and they gave mobile to their child with nursery rhymes on so that they can settle down and work properly. Child used to spend the whole day watching nursery rhymes. While asleep as well, the child used to blabber words of rhymes. At times, she used to get up from sleep asking for phone. She used to be extremely irritable, angry, violent when her parent didn't give her the phone. After that, when parent realized that she is very much dependent on that YouTube channel and she's not eating anything until it is on and she's not doing anything except in watching that channel, they consulted a pediatrician. So after that, pediatrician told that she is sort of addicted to that and you need to withdraw that digital stimulus, otherwise she might need a rehabilitation. So parents completely cut off that digital stimulus. So one thing that you should never do in any case of addiction is never withdraw the whole stimulus at one go. Decrease the intensity, then take it off, then taper it off. So fine. So parents completely cut off her digital stimulus and they introduced her to sensory stimuli games and toys. They instead of phone they gave her toys, but that connection with the child was not still there. So they were not spending that much time which was needed to be spent with that 1.5 year child. So child became highly irritable and violent and stopped talking after that incident. So now she doesn't ask for that video or phone, but she have entirely stopped talking after that. And when I talked about the environment at their home, it is a bit tense environment at their home because her mother and father, they both had a love marriage, and that guy's family was against that, and still they got married, and after that she gave birth to a baby girl. And they never wanted a baby girl, so there was a neglect from the grandparents as well as parents who were busy in their life. They also neglected the child. So the quarrels between the parents affected her. Whenever the parents used to fight in front of her, she used to start shivering and she used to hide in a corner. So they have a pet dog at their home. She's very close to him. If she's separated from him, whenever they go out or something like that, whenever she's separated from that dog, she becomes very highly irritable. There are desires of chocolates and sweets, aversion for spices. I didn't take aversion to spices into account because children don't usually take spices. Intolerance from formula milk. She's on formula milk. Her mother also didn't feed her well. So it causes both diarrhea and constipation, and she had very violent dentition symptoms. She got high fever, diarrhea, constipation. That was a very long case. I'm not getting into the whole case right now. And she have a very ravenous appetite. She feels hungry at very short time, eats well each time. So this was the case. If any of our viewer have any inputs or any remedies to tell, if they have in their mind, you can please tell me. So if you have any input, you can let me know. So I'll tell you what medicine I prescribe. I prescribe that patient magnesium mule because, earlier I was thinking of chamomilla as the medicine because that child was highly irritable, cross, ailments of fight between the parents. But chamomilla is a very acute medicine. So, it would have only palliated few symptoms, but my main concern was that child is not able to talk, and child is not able to talk after that episode when her digital stimulus was taken away from her. So I opened my repertory and I typed one symptom. Like I did it very later on. First, the symptoms that I considered was first a neglected, forsaken feeling in the child. Right? She has a when we talk about magnesium group of drugs, so magnesium group of drugs are those drugs which have a very deep forsaken feeling in them. So they magnesium group of remedies are the drugs for orphans, as Dr. Kent have said. So those children who have never got any attention, any care, any concern from their family, comes into magnesium group of remedies. So I had this in my mind that I would go for magnesium. I was not very sure whether I should be going with magnesium carb or magnesium mule. I had this impression in my mind that magnesium mule are very quiet, calm, they are peacemakers. On the other hand, magnesium carb can be very irritable. But I read one materia medica, that is Vermilion materia medica. I was going through magnesium carb, so I'll just open that book from for now. So I am opening Vermilion Arcana Prisma, that is. So I'll go to navigation window. I'm going to materia medica. All the contents have opened. Now I'll open my remedy, that is magnesium carb. Or I've bookmarked as well. I'll show you. If I go to bookmark, my case was 552. Yes. So if I go down, there were few things that attracted me. Magnesium personality characterized by activity out of bond. That child was a clearly hyperactive child. So it is talking about magnesium family overall right now. So it is a continuous flash fires and explosion of endless emotional ups and downs and angry outbursts and fearful depression. Magnesium may be well called the most violent, ill-tempered, erratic, also fearful and depressed remedy. So that child was very violent, ill-tempered, battamiz bacha. But on the other hand, whenever patient used to fight, she used to get very fearful. Right? So its nearest resemblance would be chamomilla, the drug I was thinking of earlier. Then if I go down, they are helplessly under the sway of their drive and impulses. So magnesium group of drugs, they work with their impulses. The patients are excessively oversensitive, hysterical, irritable, and subject to extremist form of emotional tensions. They are utterly unable to control their emotion or impose any type of self-discipline upon them, subject to violent rages, fury, temper tantrums, and terror of the family or the office. So now moving on. It definitely would deserve a trial in most promising drug in maniac, depressive, as well as schizophrenic patient whenever the symptom agree. In actual near psychotic state of my own experience, most frequently the indication of magnesium use. So whenever we talk of quarrels, whenever we talk of very aggressive, violent, ill-tempered child, magnesium mure can be a drug. So don't always think of magnesium mure as peacekeepers, which we read in every materia medica. They can be very violent as well. They are very sensitive to quarrels. Fine. They have a forsaken feeling in them. Now, if I go to magnesium mure. I didn't repertorize this case. I just went with materia medica approach. Fine. Patients are usually peaceful. They are known as peacemakers. Though they are completely against aggression and violence. But when they have it enough, then they tend to burst out. Now, if we go over here, they have great desire for sweets, and they have aversion to milk. That child didn't had, aversion to normal milk, but she had aversion to formula milk. So I took that as intolerance to milk as only. So these were the few symptoms that pointed towards mag-mu. Then one of the very beautiful thing that I later found in the repertory, I didn't get it that day. There was addiction of the digital stimulus. Like there was addiction to that YouTube channel. So at one follow up, I was just looking for addiction. So I'm going to my search engine and looking for addiction. If I search that, you'll get, sorry, I'll make my search to all repertories for now. You can see all different repertories. So I was going through each rubric if I can get any rubric related to addiction to digital stimulus. So I got one in Degroot's repertory of dream. So you can see this rubric, mind, TV, addiction to. And there are 3 drugs in it, that is carcinosin, lacanine, and magnesium mute. So that was one of the confirmatory, drug that made its confirmation. I was going to give chamomilla to the patient because in the first follow-up, patient didn't, presented with much improvement. That patient just presented with she was slight better with her constipation. There was no change in her mood and affections. So along with my medication, that was magnesium mute, I advised her for psychotherapy as well. That child is getting speech therapy. And one thing I advised to that patient, her mother, was to spend more time with the child, to go for more sensory stimulus play, and do more cognitive games with her, like stacking the blocks or making the puzzles if she can. And I asked her to take her child out to play with the child of same age group, because when a child is in the environment, when she is surrounded with the children of the same age group, that would encourage her to speak up more. So now that child, along with my medicines, speech therapy, all the measures that have been taken by her parents, she has now started to talk a bit. Earlier, I was going into an impression that she might be autistic as well, but the other symptoms of autism, like repetitive behavior, only regression of milestone was there. Rest of the symptom was not there. So this was one of my very recent case and very good case of mine. So always consider psychotherapy along with your medicine. So now moving on to my second case. My second case is of 13-year-old girl, again a case of neglect, who presented with complaints of delusion, absorbed in fancies, and violent behavior since 5-6 years. She was very much attached to her grandfather, who died 6 years back. Her father is a naval officer and mother is working. So she was looked after by a nanny. They were 2 siblings. Child developed delusion that her parents love her brother more, as she looks after him more, as he was premature and prone to get ill. So her brother was born near the time her grandfather died, and that child was a very premature child, and he frequently used to get ill. So her mother gave more attention to that child, and father was not there, so she was looked after a nanny. So that girl, she started to fantasize about having a perfect family. She started to imagine about few imaginary friends. She was always absorbed in her fancies. She used to beat her younger brother. She also burned her brother with an iron once. So once her mother was ironing the clothes and it was hot, she switched it off and she put that hot iron on her little brother's arm. She was poor in studies but good in co-curricular activities. This is a bit older case, just when I just got into my practice. So I didn't wrote down the whole case. I just wrote down the key points. So the whole thing was her few friends, they noticed that she lies a lot. Like she used to steal money from her home, from her mother purse, and she used to buy things and she used to show off in front of her friends that my dad got it for me, my uncles got it from me from US, and she used to lie a lot. And then when her mother confronted her, she behaved in a very erratic way. Ki, it is all due to you. You never gave good. You always loved him more, and all things like that. So this was the whole case. If anyone have any inputs on the medicine, please let me know. Yeah, carcinosin is also there, but Dr. Dilip, that child was not a carcinosin child. Carcinosin child have a very strict parenting. That those parents always want their child to be on top on everything, and they are very well disciplined and well behaved child. They are carcinosin, so that's why I went for Magmure instead of like carcinosin. Dr. Mohammed Zahid, why didn't I went for repertory instead of materia medica? I didn't went for repertory because I had this in my mind that this child might require a magnesium group of remedy because of that forsaken feeling, that abandoned feeling, that orphan feeling, because she was not getting any time, attention from her family, because she was a female child. She was overlooked by her grandparents as well. That's why I had this in my mind that magnesium might go. Yes, Dr. Sheikh, lachesis was the drug which I gave. Yeah, calcareous self-sibling rivalry is there, but the thing that worked well for me was lachesis. I prescribed lachesis, absorbed in fancies, jealousy, very prominent features of lachesis. So if I go to, just I'll open repertory. There is a concept over here in repertory section, which is mind concepts. So I've clicked on it. You will get everything that you can get in different mental condition. If you are not sure which rubrics to take, do refer to concepts in Radaropus. So it would give you all different sections, and different sections are given, and each section have a book tag in front of it, which consists of rubrics related to uh, that particular section. So if you are confused which rubric to take, you can refer to concepts. So for this case, I went to affections. So I'm just scrolling down instead of going like this. This is violation. After that, I'll get affections. Yeah. So in this heading, if I go to revenge or jealousy, envy, you will get similar sort of rubrics. So just if I go to jealousy, you will get all the rubrics that can be taken in cases of jealousy. So where it is, just a second. Delusions, jealousy with. This was the rubric I was talking about. So she had so many delusions in her mind, and there was a factor of jealousy as well. Jealousy which developed to various delusions. So if we talk about this rubric, there are two drugs in it, lachesis and stramonium. Lachesis is given in higher grade. Now I'll go to mind concepts again. One of the things that I observed in that case was um, she didn't had any sympathy or any pity towards her brother. So I went to pityless, and there are so many options to choose for. So you can go for hard-hearted cruelty, indifferent suffering too. So I went to cruelty. So in cruelty as well, you will get lachesis in 2+ grade. So this was my second case. I prescribed lachesis in that. The patient improved very well. I asked her mother to, spend more time with her daughter. I advised for psychotherapy, and she was improved to a very great extent. So this was all about my second case. So this was all about mental ailments and how to do that with Radaropus. So I just demonstrated you two cases how features of Radaropus can help you in your practice, how it have very beautiful books to consult from. So if any one of you have any queries or doubts related to the topic or related to Radaropus, please feel free to ask in the comment section. So if there are no further queries or doubts, I'll be concluding this session. Thank you everyone for joining this session. It was a great session, great participation from all the from everyone who have joined us. So thank you everyone. Have a great day ahead.